Hello, my name is Emma Remy, and I'm going to be doing my psychosocial assessment. I'll be practicing general principles and safety practices throughout this whole skill today. So the first thing I'm going to do with my patient is establish rapport. Hello, my name is Emma Remy, and I'm going to be your nurse today. How are you today?
I'm doing fine.
That's good. I'm going to assess their chief complaint. What brings you in here today?
I just haven't been feeling myself lately.
Okay, I hope we can get to figuring out that issue, and I hope it gets better. So now I'm going to review my patient's physical status and health history. So I'm going to ask for your name and date of birth.
My name and date of birth, my name is Charles Richard Remy, and I was born on September 23rd, 2004.
We're just making sure we have the right patient so we can make sure we're reviewing the right physical status and health history information. And I'm also going to assess my patient's baseline vital signs such as heart rate, blood pressure, pulse ox, O2 stat, respiration rate, and temperature. And also just see if they have any allergies, which is always nice to know. So I'm going to assess some safety concerns. Do you have thoughts about harming yourself?
No.
Have you ever harmed yourself?
No.
Do you have thoughts about harming someone else?
No.
Have you ever hurt someone else?
No.
Do you have concerns for your safety?
No.
All right, and now I'm going to assess my patient's appearance. They have good grooming and dressing for it's good and appropriate for their age. They have good adequate hygiene. They have good hygiene. They maintain appropriate eye contact for the situation. They don't have any skin markings. They have good and erect posture, and they have appropriate body language for a situation. Their affect, I'm going to assess their affect and mood. So their affect is bland, but it's appropriate for the situation. And their mood is sad, based off what they told me. They're calm, though. And their behavior and motor activity I'm going to assess next. He is calm, sad, maybe restricted with what he's telling me. His motor activity, he had a good balanced gait when he walked in. He has no abnormal movements, and he has good eye contact. And his speech so far, he's had a normal rate of speech, a normal volume of speech, and normal articulation with me. And so I'm just going to ask, what have you been thinking about here recently?
I've just been thinking about how sad I am.
Okay, so I would say his thoughts are coherent, but that he is having sad thoughts. His thought contents are sad. And do you have any hallucinations or illusions, or do you see anything?
No.
So he has good perception. He has no hallucinations or illusions. He is cognitive. He is oriented to time, place, and person. He is alert. His level of consciousness is alert. And do you remember what you ate yesterday?
Yes.
So I would say his memory is long term because he remembered his date of birth and told me his name, and he remembered things from yesterday. Okay, now I'm going to assess my patient's alcohol for any alcohol or substance abuse. What medications do you take? How much and how often?
None.
Okay. What herbal or over-the-counter drugs do you take? How much and how often?
None.
All right. And do you drink alcohol? How much? How often?
None.
Okay. Do you use recreational drugs? How much? How often?
None.
Okay. Now we're going to assess our patient's sexual patterns. Are you sexually active?
No.
Since they're not sexually active, we would not. I would ask if they practice safe sex and practice birth control. And they'd probably say no because they're not sexually active. Now I'm going to assess their support system. Describe your family to me.
I have a nice, loving family.
Describe your friends to me.
I have friends that like to support me.
And who do you depend on to give you support when you need it?
My parents.
And tell me about where you live.
I live in a caring home.
Is it a nice, safe home, safe environment?
Yeah.
Okay. All right, and now I'm going to assess my patient's interests and abilities. What do you do in your free time?
I like to lift weights.
Like in the gym?
Yeah.
That's good. Do you participate in any hobbies or sports?
Yeah.
What sports?
Football.
And hobbies?
Weightlifting.
Oh, that's a good one. What gives you pleasure in life?
Just lifting weights.
All right, now I'm going to assess my patient's coping abilities. What do you do when you are upset?
What I like to do when I'm upset, I like to go to the gym.
And what helps relieve stress?
Going to the gym.
Those are good coping abilities. All right, and I'm going to assess my patient's spiritual status, cultural, see if they have anything there. Do you have spiritual, religious, or cultural practices that we need to consider in the care that we give you?
No.
You don't have any of those? So There wouldn't be any restrictions on diet or medical interventions within your spiritual, religious beliefs or cultural practices?
No.
All right. And that is our psychosocial assessment today. Thank you.